it's 11 o'clock or 11:01. So welcome everybody to the Panhandle District 1 Fiscal Year 22 Board Hearing, Budget Hearing, excuse me. I am Commissioner Chris Valios. I'm the Chairman of the Kootenai County Board of County Commissioners. I'd like to welcome everybody here. The time is, I have 11:02 a.m. Today is May 27th. And as I said earlier, this is our fiscal year 22 budget hearing. And at this time, what I'd like to do is take a roll call, and we'll go around the table, I guess, and we'll start with my right with Commissioner McDonald, Bonner County.
Commissioner McDonald, Bonner County Chairman.
Who's next?
Glenn Bailey, Bonner County Representative.
Thank you. Sir.
Alan Banks, guess I'm the at-large representative for
Okay.
all 5 counties.
Mark Lyons, attorney for the Health District.
Dick McCandless, board member and Kootenai County representative.
Okay.
Laura Whalen, Director of Panhandle Health District. I just spoke with Commissioner Tim Mertling, who is our Boundary County representative, and his ETA is 15 minutes.
Arnold Thompson, Panhandle Health District Board Chair from Panama County.
Mike Fitzgerald, Shoshone County Commissioner Chair. Bill Lambert, Benoit County Commissioner Chairman.
Christine Kummer, Financial Manager.
Okay, so that takes care of everyone. I'll turn it over to Chairman of the Board, Mr. Marlo Thompson. Go right ahead, sir.
Thank you, Mr. Chairman. Glad you could be here. It's always a high point right here. And it sounds like it's a good thing we have this once a year, because I keep hearing some of you commissioners saying to each other, you haven't seen each other since last time. But welcome, and glad to have you here. Trust all of goes well with us here today.
Okay, thank you. And so we'll proceed with Laura Whalen, our director, and Christine as well, regarding House Bill 316, which essentially will govern how we go forward. Laura, please.
Thank you, Mr. Chairman. Christine has sent out to all of you this PowerPoint that she's got up on House Bill 316 and the county appropriation impact that is causing in this current FY22 budget that we are looking at today. It will, it is not the full 12-month state appropriation that we're asking that the state has shifted to the county, rather 4 months. So Christine, would you like to go through that PowerPoint presentation, please?
Certainly, thank you. So basically what I've done is attempted to design a roadmap, since House Bill 316 is based on the fiscal year 21 appropriation. I'm not going to go into each slide in detail. Some of it will be a high-level view. We'll look at other areas in more detail. So this first page is just an explanation taken from the Idaho Association of Counties analysis explaining what House Bill 316 is. And I think we're all aware of the fact that it's shifting funds, the funding from the state level to the health districts to the counties now. This is a reminder of what our budget is. We came out and visited each county, and our fiscal year 22 budget is $14,191,000. The only difference in this compared to what you saw when we were visiting is this section right down here. I've broken it out to county general aid, the $1,237,000, which is unchanged compared to fiscal year 21. A new line item for House Bill 316, which represents 4 months of appropriation, and then what the county is appropriating for the 8 months for fiscal year 22. Now, there is a slight change of $22,000 because there was some shifting in funds before HB 316 was passed that reduced funding at the state level by about $22,000. So that's the only difference in this budget than what you saw when we were visiting. Now, this is where the roadmap begins. So total funding for fiscal year 21, which will be the base for House Bill 316, is $1,222,000. And that started with Senate Bill 1353. So we see the total appropriation of $9.8 million. We see the time period there. And then we also have some adjustments that are related to the total funding, but we need to remove that $105,000 from the appropriation amount because that was specific to District 4. So also in fiscal year 21, there was a 5%, or excuse me, yes, 21, there was a 5% take back. The total take back for all health districts, once you remove the District 4 component, was $485,000. And when I say the District 4 component, they did get their general aid from the state, but there was an additional amount that they received for healthy transformations that is not part of the general fund. So this slide represents the final amount that was allocated to the districts. It includes the holdback. So this shows that District 1 received for fiscal year 21 appropriation of $1,222,000. So that's what House Bill 316 will be based on for fiscal year 22 and years going forward, unless it's changed. These sheets here, I'm not going to go into detail. They just support the numbers that I just cited. It shows the state formula, it shows the amounts by district, but it also shows definitely District 1. It's just additional detail to support the numbers just presented. Now we're at House Bill 396, which is the funding for fiscal year 22. So the 8 months that the state will be funding for the health districts is $6.8 million. We see it in the funding formula here, and Health District 1 will be getting $870,000 of that money. This is just a reminder of what the county funding formula is 70% based on population and the 30% based on property valuation. This slide is an addition to statute 39424, and it's further explanation of what 316 is and how it is to be applied. Now, this is what I want to focus on more. This is the allocation formula by counties. It's similar to what you've seen before in your annual presentations, but what I've done is I've added a new section specific to House Bill 316. In the upper right-hand corner here, you see the general county assistance of $1.2 million. And here's the allocation right in this upper third section that you saw when we were out visiting. That remains unchanged. This section here is the new component for House Bill 316, and it represents 4 months. And it's also allocated based on, of course, the population of 70% and property valuation of 30%. So then here is the grand total of both the general county assistance plus House Bill 316, what it looks like in total for each county. See if I can get it up here without a line right through it. Been a long, I'm sorry, I can't.
So okay with them, pick up.
Thank you. So in total, the counties for the health districts fiscal year 22, in total, the impact is $1,644,970. And that brings us back to the budget here, where you see the $407,000 for House Bill 316, the 1.2 in general county assistance, and the 870,000 in the state appropriation. Are there any questions?
Yeah, Christine, I do have a question. The 1.6, I presume is 12 months?
That is
The
correct.
1644, okay.
That is
thank you.
correct.
Any questions?
Well, I just want to say thanks to Kootenai County for deciding to pick up on our county share. We really appreciate that.
Anyway. Any discussion? I do have a couple of questions for Director Whalen or Christine. So there was quite a bit of an allocation this year as a result of COVID. So when I look at the level of increase from the amended fiscal 21 going into this current fiscal year 22, or beyond actually, when we look at fiscal year 23, how would you handle that? Go right ahead, please.
Commissioner Sherman, thank you. You know, COVID is, I wish it was black and white. It's not. I do know that there continues to be grant funds. Our COVID costs are 100% covered by these grant funds. Have been and from what I've seen will continue to be funded 100%. So no county burden pertaining to COVID whatsoever. It's all federal funding coming through the state to us. The FY22 budget as far as COVID expenses goes is a guess. It's an educated guess, but yet it is a guess. How many FTE, how much grant funding, it really depends on what happens with COVID, both locally at the state level and nationally. Christine, anything you'd like to add?
I'd just like to remind everyone that the fiscal year 22 budget is 3% less than the amended fiscal year 21 budget. And then if we remove the COVID component, it's an increase of approximately 1.7% that the district is assuming. But that 1.7% is related to the HRSA grant that we receive, which is $1 million over 3 years. So there's an additional $333,000 in the fiscal year 22 budget, which accounts for that 1.7% increase.
Any other questions? I guess you're all convinced Kootenai's gonna pick it up, so I guess I'll ask.
All in favor, say aye.
Okay, but to your most recent point, Christine, if I look at salary and wages for the fiscal year 21 original budget, which was 5.9 mil, approaching almost 6, salary and wages. Page 3 in the handout.
You're almost there.
Oh, well, I am.
You're on it, okay. So if I remove the COVID component, we're basically increasing salary and wages from almost 6 million to 6.8. Right?
Correct.
So that's about a 12 or 13% increase.
have my explanations.
Wait. Okay, go right ahead.
No, go ahead.
Yeah, so basically, the reason I'm saying that, and I understand, I mean, it is in fact a reduction because of the COVID component, but as we look forward, the logical question is what happens in '23?
Well, if I may,
Go right ahead.
let's take a look at fiscal year '22. What we need to keep in mind is that per the governor's recommendation, there's a 4% salary increase in there.
Fair enough, okay.
And you're just focused primarily on personnel costs, or salary and wages, not fringe, correct?
Yeah, for now, yeah. You can go on to fringe, go ahead.
Okay, so we have the 4% increase in salary, and we do have a couple of new positions that have been added, but those new positions are fully funded. For example,
By federal dollars.
No. Yes and no.
Okay.
But,
Awesome.
but the example that I was going to cite specifically was related to environmental. Because of the tremendous growth that we have, as it relates to the construction industry, we need to have two additional environmental health specialists to be out in the field,
Okay,
okay?
And aren't those positions being offset by revenues coming in?
Exactly,
Yes.
exactly.
okay.
So are you ready to address fringe?
Yeah, go right ahead, please.
Okay, so please recall that the fringe, the reason for the increase, and of course, fringe will increase if there's a salary increase.
Clearly.
Okay, but the defining element in the fiscal year '22 budget is that health insurance increased from $11,650 per individual to $12,930. So that's going to account for the majority of the increase related to fringe.
Okay.
Mr. Chairman?
Yes, please.
If I might, Christine, could you, the salary dollars, what would they be without the COVID FTE that are federally funded that we put in there as compared to FY21 budget?
Identified changes, there was 1.2 million in COVID personnel cost.
And should we not, I mean, this is where the guess comes in, right? Should we not need those FTE? Certainly we would delete them or not bring them.
Understood.
Right.
Okay. All right then. Just as a point of clarification, total trustee payments to pass through, can you explain that?
Yes, the pass-through funds, the majority of that is related to a public health preparedness grant where they have, I budgeted 80,000 for that pass-through component. And it's specifically related to the Regional Healthcare Coalition, which encompasses both District 1 and District 2. And it's specific for pass-through funding to assist community partners.
Fair enough. Do we have any other questions? Hearing none?
Mr. Chairman,
Yes.
the increase for your employees for your environmental, septic checking and things like that, is that gonna be enough people to, handle the job?
That's a good question.
And maybe the follow-up would be, do you anticipate adding additional staff?
I think the answer to that would be, it would be contingent upon what is happening with the level of construction and the need out there. And if we would need to increase, we would accordingly. But that would take a lot of discussion and approval between Joe and the director.
Has there been any discussion about increasing the fees for septic permitting to help offset costs?
I would need to defer to
Thank you, Christine. Mr. Chairman?
Please.
You know, no, I mean, we are not, I am not, and have not this year, and don't anticipate that we will, increase fees next year.
And why is that? Because I'll say one of the successes we've had is, looking at user fees and using it to offset, using that revenue to offset taking tax dollars. So
we
user
use-
pays.
Great, thank you, Mr. Chairman.
Please.
Joe looks carefully, annually, and more frequently at what are, because we've got all these different, we call it TCAs, which are cost centers. And looking at what are we covering with our fees, are we able to cover, what's there? And we are pretty much in alignment in that particular program. Maybe just a little bit under, but mostly in alignment. But certainly, and that's why we raised the fees in the first place, because the board, over the course of the years, has very much been a proponent of the user paying the cost. Because really, if you look at a septic system, it's like a sewer hookup, right? And what does that cost to do?
Right. And are there statutory limitations that keep you from moving that north of where you are now?
Not at all, just, the only statutory limitation that is in place is that, we're not to make a profit, right? I mean, we gotta be cost control. And we certainly are.
Any other questions?
So currently it is covering cost of the service then?
More or
Inspection.
less, I mean, there's a lot of component parts. And certainly discussion is had with the board on a regular basis. If we do need to raise those fees, there would be a lot of discussion, and a lot of data supporting, the need to do so straight.
Yeah, I just want to make sure we're covering costs. That's important. We don't want to do a tax shift onto other folks for
Absolutely.
services being, acquired by someone new especially.
Right, and if I'm misspeaking, Joe, please correct.
No, it's very accurate description. Essentially, we're kind of in that wondrous moment where we're at maximum capacity with staff and we're in growth. And so the fees are covering the program costs right now. But as we project ourselves into the future and other costs go up, I mean, fuel, for instance, is, you start adding $1 a gallon for fuel and the inspectors use a lot of fuel, that could change the component. But right now, this month, we're looking good. We look at efficiencies far before we look at raising a fee. So, that's why we haven't raised it in some time, is we found other ways to cut costs rather than raise fees.
Yeah, and I just want to make sure I'm not opposed to raising fees. I think it's a likely place to realize, additional revenues to help offset other things. If we can do that, I think it's probably the best way to go.
Mr. Chairman, my
Yeah,
concern
please.
was they had enough staff to do the job adequately and on a timely basis and not have people waiting
Mr.
extended
Chair,
periods of time.
Yes.
Mr. Chairman and Commissioner Lambert, thank you for the question. In fact, Joe and I were just talking about that, because our goal is always a 3-day, we get the application and we're communicating with that individual within 3 days. And we may be lagging just a little bit, but not extraordinarily in that. We're doing a look back, but that's the standard is.
Well, that's good to hear.
Yeah.
Thank you.
Okay, any other questions? None? Just for clarification, page 12 in your handout on the budget. So when I look at the allocation, second table below, so basically what we're looking at there is a total 4-month allocation. So is it a fair statement that that figure in the last column should be multiplied by 3 for an annual? Christine, I'm sorry, you're trying to drag me. Page 12.
Okay, I'm on page 12. That would be a 4-month allocation because it doesn't become effective until
March.
3/1.
Okay. So annualized?
So annualized, that's $407,000.
Okay.
For this. But
For
then
the
going into the
HP
next fiscal
for-
year.
For our fiscal year, yes.
But in FY23, what would it be, Christina? It would be that times 3.
That's,
It would be times 3.
it would be
Yes,
times 3
1.2
for
million.
fiscal year 23. Okay.
We don't have to thank the state legislature for their help.
Yeah, really.
it would be the FY21 state appropriation amount, which was
$2,222,000.
Okay. So the 166, almost 1645 is 4 months, 1/3 of a year.
Well, the one,
I'm sorry,
No,
the 407,000 is
One.
1/3 of a year. So essentially, going forward to fiscal '23, we can essentially triple that number,
yes,
Plus whatever additional population.
plus additional
Yeah,
population, exactly,
and valuation.
which is probably not going to relent.
No, I don't think.
In the near term.
For a near term, yeah.
Okay. Any other questions? Hearing none, I'll entertain a motion.
I move to approve the FY22 budget as proposed.
Is there a second?
I'll second that, Mr. Chairman.
Okay, Commissioner Fitzgerald seconds, Commissioner McDonald made the motion. Any further discussion?
No, I just want to say, thanks Christine, thanks for this morning for shooting me those budgets down from prior years too. I went through them and that's kind of my wheelhouse with the county. And I think it's a very nice, clean budget.
oh, thank
Did
you,
a fantastic job. So
much appreciated.
I was trying to find something, but
I'll second that one. No discussion? We'll take the voice vote. All in favor?
Aye.
Anyone opposed? Motion carries. Fiscal year '22 proposed budget for the Panhandle Health District 1 is hereby approved. Thank you, everyone. I guess that's it. Motion to adjourn?
so moved.
And a second, okay. Commissioner Fitzgerald seconded, Commissioner McDonald first. Time is now 11:28, and this meeting is adjourned. Thank you, everyone.
Thank you all so very much, I appreciate, very much appreciate your support, and